Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Welcome back to another episode of the Wellness Optimizing Warrior MD podcast. I do apologize for not recording an episode last week, but my mother had a cardiac arrest at home on February 6th, and we were in the middle of cooking dinner. She had just come from the office where I gave her an IV vitamin infusion because she had been dealing with some kind of a diarrhea for the past 3 weeks. And I guess I failed to realize how important potassium is, especially in an elderly woman. Long story short, luckily she had a short syncope. I called the paramedics and they were at home when she went into ventricular tachycardia, which is basically the heart no longer beating well. And they were able to resuscitate her, bring her to the hospital. Well, she's been in ICU for 11 days and she finally this Wednesday got downgraded to telemetry. And the day I'm recording this episode is February 22nd. So good news, it looks like she's making a good recovery, and I will tell you more about her story and my encounter with the institutional hospital medical system about 15 years later after my father's unfortunate passing in 2011. I will dedicate an episode with a very informative discussion about what you should expect when you actually go into a hospital, especially when you're critically ill, and how important it is to actually have a patient advocate, someone who understands the system, understands the inner workings, knows something about healthcare, and can actually help you. But today's podcast episode is literally meant to continue to raise awareness of the importance of the pelvic floor muscles. So I'm going to continue the discussion about the pelvic prolapse. Now, these pelvic floor muscles are a very small component of your entire muscle mass, but they're such a crucial one, especially for women who are more sensitive to pelvic floor trauma because they've given birth vaginally, so because of childbirth, and in whom the pelvic floor strength and endurance, it will be more so intimately tied into the available estrogen. In the last 2 episodes, I discussed how the process of aging, the loss of estrogen at menopause, and how the childbirth trauma are huge factors in causing or worsening pelvic floor weakness, incontinence, and prolapse. Women start with the loss of estrogen-induced changes in the pelvic floor tissues, and that will impact the firmness, the tone, the elasticity of the connective tissue, which binds the muscles to the bones in the forms of tendons or fascia. These tendons and fascia are providing support your pelvic organs need, and the more time away from menopause a woman has, the weaker she becomes. Not just because of no estrogen after menopause or maybe low estrogen, even if you're using hormone therapy, but because women also stop being sexually active as they age. And even though they exercise and go to the gym, I have not heard any woman tell me, I go to a vagina gym. I did come up with the term vagina gym a few years ago on social media, and I've been advocating women clients to consider joining a vagina gym. I believe women should have vaginal gyms. We kind of do. They're called your friendly pelvic floor therapist, but many women hate going to the pelvic floor therapist, and most women feel it is pretty invasive. The compliance is not great. And then you have to actually do the exercises that you're taught at home on your own. And many women, just let's be honest, do not do it. Also, it is expensive and your health insurance plan will only cover 12 sessions a year. So that's that. Now, all women is very interesting. Every single woman, once they realize they have developed prolapse, once they have clear signs and see visible and palpable evidence of pelvic floor weakness and pelvic floor dysfunction, every single woman becomes highly motivated. They want the pelvic floor therapy, and they want to spend money on pelvic floor muscle building with electrical muscle stimulation at home, in a doctor's office setting. But by then, the damage is done. Once prolapse has already happened, investing in your muscle strength and tone of the pelvic floor is going to simply prevent worsening the condition. It will not necessarily reverse it or cause a tightening of your fascia and the tendon tissues that ultimately are the ones responsible for the vaginal tightness and holding things up, not just your muscles. One of the main problems of why pelvic prolapse is so hard to manage to a woman's satisfaction and with meaningful, long-lasting relief without surgery is the fact that it's most always diagnosed in an advanced stage. And there are quite a few factors explaining this late diagnosis and contributing to it. So I'd also like to review them in today's episode because, again, this topic is meant to raise awareness and give you some tools and opportunities to actually take action early before you get in that situation. Here's number one factor. Many women have stopped going to the OBGYN doctor for their annual pap smear exam. They're now getting their annual exam, the pap smear, with a mid-level provider or their primary care physician, which is usually a family practice, MD or DO. None of these providers are trained in diagnosing, detecting, and managing pelvic organ prolapse. When they do an exam, they focus on collecting the pap smear, making sure you don't have any big infection or any other problem, and they focus on finishing the exam as soon as possible. It's somewhat invasive and uncomfortable, and they want to do a good job. Just collect the pap smear, and you're done. Number two, even if you wanted to go and see an OBGYN for your annual pap smear, many OBGYNs are very busy delivering patients in today's world, and they do not have the time and the energy to dedicate a lengthy discussion to prolapse prevention or warn you, other than maybe briefly for like a minute, hey, there's some pelvic floor relaxation and you probably should do some Kegels, and that will probably be happening at the time of your annual pap smear. You will need a separate exam and a different appointment that you will need to make to specifically get an evaluation for prolapse risk, okay? And number three, very few OBGYNs are practicing menopause-focused care and dedicate time and energy to educate their patients regarding the importance of preventing pelvic organ prolapse, like I do. And even fewer OBGYNs test your pelvic floor strength by asking you to squeeze your pelvic floor muscles during the exam so they can actually do an assessment. So what could you do about these things? Yes, you could make an appointment with an OBGYN doctor. Yes, you could ask for an evaluation for pelvic prolapse risk. And if you do see a gynecologist for whatever reason, outside of a pap smear, your pap smear, it's complicated. It's really just covered when you come for the visit just to get a pap smear. But you could simply ask your doctor to evaluate the intensity of a self-generated contraction of the pelvic floor muscles and give you an assessment. It takes 5 seconds. You can do that yourself by just inserting 1 or 2 fingers vaginally, perhaps in the shower, and then testing to see how capable you are of contracting the pelvic floor muscles just around your fingers. If you can barely feel the squeeze around your fingers, you really should see someone as soon as possible and get a treatment plan. Many women are under the impression that pelvic floor therapy could help, and it does as long as you're able to generate a reasonably strong contraction of your own pelvic floor muscles. If you are able to identify and contract your pelvic floor muscles independently of your abdominal muscles, your buttock muscles, then you will be able to continue working out your pelvic floor muscles, and you will be capable of performing the exercises recommended to increase the strength, the tone, the firmness, and the support provided by your pelvic floor muscles for all your pelvic organs. Unfortunately, many women are not able to generate the contraction that is strong enough. And if they do, they will recruit the abdominal muscles and the buttock muscles. In the process of let's give it all we can, right? It's probably a good idea for the buttock muscles, but not a good idea when you recruit your abdominal muscles, because instead of contracting your pelvic floor, you're actually contracting your abdomen and increasing the pressure on your pelvic organs, which is counterproductive. And if you are not able to generate that strong contraction, it's not going to necessarily help you with your ultimate goal of strengthening your pelvic floor. You have to be able to identify the pelvic floor muscles which are primarily responsible for continence and for support. The levator ani muscle group, which is comprising of the pubococcygeus, puborectalis, and iliococcygeus muscles, and the coccygeus muscle. All of these muscles form like a hammock structure, supporting your pelvic organs, also wrapping around the urethra and the rectum in the manner of a sphincter, and constricting the urethral opening and the rectal opening to prevent involuntary leakage. These muscles need to be strong and under voluntary control for you to be able to be continent. When you find yourself in a situation where you cannot identify and feel that squeeze, or it's very weak, you attempt to prevent the leak, you're not able to control your bladder, it is best to consider electrical muscle stimulation or electromagnetic therapy, neurostimulation, because at that point, pelvic floor therapy can only work with what you have. Whereas these neurostimulation technologies can help you recruit new muscle fibers and allow you to actually strengthen your pelvic floor rather than simply preventing worsening of the weakness. If you did not know, it turns out some insurance plans, including Medicare, actually cover these sessions, especially when there is a valid diagnosis to accompany it. Weakness of the pelvic floor, pelvic prolapse, urinary incontinence, etc. So let's talk about these technologies a little bit more. The first one I want to talk about is the Emsella chair. The Emsella chair sessions are approved by the FDA for this specific purpose. And because there is an FDA approval, many insurance plans, including Medicare, are very likely to cover it. The idea is to find a physician office with an Emsella chair who actually accepts your insurance plan. Now, I happen to be one of these rare offices, and I love it when our patients are able to get improvement and better control, sometimes in just a few sessions. I have heard even faster for some younger women who say they feel more control just after one session. It's spectacular, right? So what is this Emsella treatment? Emsella is an FDA-cleared or FDA-approved non-invasive medical device designed to treat urinary incontinence and strengthen the pelvic floor muscles in both women and men. It uses HIFEM technology, which is an acronym for high intensity focused electromagnetic energy, to stimulate the pelvic muscles. Typically, you need 6 to 8 sessions, but in advanced age, over 60, and very severe conditions, I tell patients very honestly, you're looking at 12 sessions. Each session is lasting 28 minutes, and you usually plan those over the time span of 8 to 12 weeks, so every 1 to 2 weeks apart. The use of this device is indicated for treating various types of urinary incontinence. Stress incontinence, which means leaking with activity, like sneezing, coughing, jumping, lifting weights, running, etc. Or urge incontinence, which is leaking on the way to the bathroom, leaking when you put the key into the keyhole at your house, getting up in the middle of the night to pee and not making it to the bathroom, etc. And there's also the mixed incontinence, where women have both stress incontinence and urge incontinence. So what does Emsella do? Well, it causes thousands of supramaximal contractions in those 28 minutes. Contractions which are much stronger than the contractions you could generate on your own voluntarily. And that is the key. It generates these supramaximal contractions above and beyond what you would be able to do on your own. These thousands of contractions in one session. You're not going to do thousands of contractions in your entire life, least of all in 28 minutes. These thousands of contractions will strengthen your pelvic floor muscles more effectively than any short-lived series of 10, let's say 20 voluntary squeezing exercises you're going to do at home or with your pelvic floor therapist. This is the key on how this device works when your pelvic floor therapy failed to help. When you do your pelvic floor therapy by yourself or with a therapist, you're only able to generate a limited contraction, whatever you can generate. Your pelvic floor muscles have already been weakened by either childbirth or by age, by loss of use, or by the loss of estrogen. So you're already in a weakened state. So you're not going to be able to generate any significant contraction, not even coming close to 10% of what Emsella will do. Obviously, this is non-surgical, non-invasive. This is a treatment during which the patient is fully clothed and comfortably sitting in a chair browsing their phone, reading a book, maybe chatting with the medical personnel. It is true, it is FDA cleared for incontinence. Interestingly enough, though, many patients report improvements in sexual function and intimacy, which again have not been specifically evaluated by the FDA for this aspect of the therapy, though there are many women who want it and seek the device out for this specific purpose, improvement in sexual well-being. Again, Emsella is considered a safe, effective alternative to surgical intervention for regaining bladder control. You just have to do enough sessions, okay? Another useful device is called the V-Tone. This technology is purely electrical stimulation. It's an intravaginal piece that looks like a little torpedo. It has two very large electrical plaques requiring lubrication to make contact with the appropriate muscle groups by placing it intravaginally. And as I mentioned before, these muscle groups are the levator ani, plus all the other muscles that are included in this group. Then the applicator is connected to a machine, to a device that generates the electrical pulses, and the intensity of the energy that is delivered is customizable to the patient and by the patient. They have the ability to go up and down by themselves, totally and fully under control, their own control. They push the buttons on to go stronger, to go weaker. And usually the body kind of gets used to the level of stimulation after a while. So the patients need to keep going up on the energy to stimulate more muscle fibers until they reach their maximum possible energy provided by the device. Most women start pretty low, but they're able to titrate up to their maximum level of comfort, where they feel an intense contracting around the device, but a comfortable squeeze of the vaginal probe. These sessions can last as long as 30 minutes, maximum 40 minutes, and they're also done every 1 to 2 weeks. Now, as opposed to the Emsella chair, in which the patient is able to sit comfortably and wear loose clothing, there's no need to get undressed. With the electrical muscle stimulation that's delivered intravaginally, the woman has to be undressed, and the probe has to be inserted at the right position in order to stimulate the levator ani, the right muscle group. If it's too deep in the vagina, it won't work because it won't recruit the muscle. If it's too far outside, it will really electrocute the skin and it won't feel good. Now, when the V-Tone device is placed properly, the provider can actually see the contractions engaged by the movement of the vaginal probe protruding fin, which is visible at the vaginal entrance. The doctor can see how effective the stimulation is and whether or not the probe position is in the good location to achieve the maximum desired effect. When you sit on the electromagnetic chair, you are the one that has to gauge whether you are sitting in the right position over the magnet in order to get the maximum stimulation and work out your pelvic floor muscles or not. The provider needs to guide you to the position. It has to talk to you and ask you some questions and guide you. And sometimes I tell patients, lean back, bend forward, open or close your legs a little bit more, depending on how you feel. And you have to feel that you're in control of your position, and what you feel, you're the only person that can know what you feel. So unfortunately, if you have had this procedure before and you had it at a med spa and nobody provided any guidance about what this should feel like and where you should position on the device and how to increase the intensity of the stimulation, then if it didn't work, it's not the machine. You have to get some guidance and you have to have some information regarding the use of it. So even though both the Emsella and the V-Tone are very good and very useful, they work differently. They both can have a significant benefit for sexual well-being. Women have noticed more intense orgasms, or they found it's easier to orgasm, and that the lubrication during intimacy, it's also improved after using these devices. Interestingly enough, the Emsella chair, like I mentioned before, it's also approved for a weaker pelvic floor in men who suffer from prostate issues, which interestingly enough are beneficially impacted by the use of the high-intensity focused electromagnetic energy with the Emsella chair. So if you find yourself in a situation where your male partner is suffering from prostate issues, benign prostatic hypertrophy with urinary problems, guess what? The Emsella chair session is really easy. They come in, they browse their phone, they sit on the chair, they get a 28-minute prostate massage, and they feel a lot better. So I hope I provided a lot of information about how you can rehabilitate your pelvic floor weakness in a meaningful way outside of pelvic floor therapy with a pelvic floor therapist and doing Kegel exercises. I want to close this episode and this topic with one last wisdom pearl. The biggest problem we have when it comes to prolapse and weakening of the pelvic floor is the fact that the timing of the medical intervention is absolutely crucial and critical and is getting missed in the majority of the time. Treating a prolapse by strengthening the pelvic floor muscles with either the electromagnetic technology or the electrical muscle stimulation inside the vaginal environment will not and cannot restore the anatomy of the pelvic organs that have already descended into the upper third or the lower third of the vaginal canal. The strength of the pelvic floor is a delicate balance between all the contributing factors, which I discussed in detail in the previous 2 episodes. The loss of estrogen, the aging, the loss of use of pelvic floor muscles, which will lead to weakening, and the weakening will lead to structural changes. Also genetic predisposition, and of course, last but not least, childbirth trauma. Being cognizant of what your own factors are is super important. For example, you delivered 3 children, they're all on the large side, and now you are entering menopause. You might want to address these very important factors, which you have 2 now, right? Childbirth and loss of estrogen, by having an absolutely thorough evaluation of your pelvic floor function every year with a doctor trained in such an assessment, and consider estrogen therapy for menopause once you enter menopause or you approach it. Period. I'm not saying that estrogen therapy after menopause will prevent all cases of prolapse. There will be false, misleading information. The point I'm trying to make is this. Should you find yourself in the category of having certain risk factors like childbirth, trauma to the pelvic floor, very large children, long labor, whether or not you show signs of pelvic floor weakening, you want to start estrogen therapy early on and consider using it not just to prevent the pelvic floor weakening and the deterioration of the pelvic floor tissues, but also for all its other benefits. And you want to start pelvic floor strengthening exercises very early. I've personally seen the damage done to the pelvic floor of many women during the thousands of vaginal deliveries I attended in my entire career. The medical profession should really make pelvic floor therapy a mandatory rehabilitation for any woman who delivers vaginally. And women should be aware that this early rehabilitation option could greatly help prevent prolapse or decrease their risk of prolapse later in life. I do like educating my patients, and I like educating women in general, because I feel a lot of the things that happen to women's health and well-being is almost hidden behind a veil with a significant amount of information not necessarily available and at every woman's fingertips. Yes, we have the internet to help. Yes, we have the World Wide Web, where you can find an absolute mountain of useless information that doesn't apply to your specific situation. What we need is more awareness on how important your pelvic floor strength is, and how absolutely vital it is that as a woman, you should dedicate some time and energy to take care of your pelvic floor, especially if you had one or more vaginal deliveries, you're entering or have been in menopause many years now, or are approaching your 6th decade and beyond. This entire episode has been about the pelvic floor strengthening of the muscles with the Emsella and the V-tone and pelvic floor therapy and the difference between all of these. Do not forget that once the prolapse has happened, the tissue's laxity can only be improved with laser therapy. We do have some amazing technologies like Morpheus V, Photona, which can greatly improve the vaginal laxity of the vaginal tissues. To end this episode, I want you to keep in mind that you should consider seeing a physician trained in pelvic floor assessments regularly, at least once a year. Invest in your muscle strength before you lose it. You're a woman. I think 80% of the people that I see in my practice are women who work out. You go to the gym, you do Pilates, you do yoga, you do all these things because you care about your body. Think about joining a vagina gym. If you don't have one, come and join ours at Hera Beauty and Wellness. We will love to have you. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas. So please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.